Of your book?
Yeah, this book is a collection of the editorials that I did when I was the executive director of the National Medical Association Journal. And at that time, I was the not only the editor, but also helped to play a role in terms of arranging a support system so that the journal can be sustaining. The whole idea of the journal is to try to present groundbreaking research that's involved with African American health and with the health that's associated with the problems that exist in a diverse and minority population.
Can you describe some of the health disparities that you observed in writing the book?
Yeah, one of the major ones that I personally am interested in, of course, is mental health. One of the disparities we've found is that despite the fact that we have new treatments, new people aren't tied in with the myths that it's associated with mental health, still a number of people are not getting mental health services or are not referring mental health services. Our own research showed that a large percentage of people in primary care clinics, in the homeless population, in the correctional system is a direct result of mental disorders. The COVID epidemic really brought this out. The rate of depression and anxiety went up in the African American community, but there was not a disproportionate increase in terms of services that were available for people. And it helped people to recognize that mental health is not just something that's limited towards mental health providers and mental health systems, but is involved in terms of general health for the entire community.
In writing your book, did you see that there are barriers to care in terms of after you've diagnosed the disparities, those that are not having disparities? Did you still see there was barriers to care in terms of some of the treatment some of the African Americans were trying to get?
Yeah, one of the issues I call mental health illiteracy. That is that many of our people simply do not have knowledge about mental health and what it means. And so we looked at other options. People end up in the correctional system. When they closed down the large mental hospitals, what we saw was an increase in the prison system. We saw an increase in the homeless population. Rather than many of these people are people that, for whatever you can say, lazy or don't have nothing better to do, they are homeless because they can't get themselves organized or they have emotional problems that keep them from doing things like getting a job, maintaining a job, or working in the community in an effective way. So mental health is not simply something that's involved in just a small group of people who may be severely mentally ill. Mental health has the impact in terms of our entire community.
As far as African Americans, who would you think is your greatest audience for your book?
Right now, I think the audience would be the general population who's trying to understand what's going on. Why do we have these people lying in the streets? Why do we have these people that's ending up in jail? Why is our homicide rate going up? Why is the suicide rate for the African American community now among the highest of any racial or ethnic group? So I think the general community, can benefit from knowing some of the factors that's contributing to these disparities.
Have you sought or have you seen any support from local leaders in terms of the support or the reduction in the disparities of African American health?
I've seen a lot of people who are committed to trying to do good. The problem is many times they don't have the information, or they are provided misinformation, or they find that economic factors keep them from moving in a direction that would make a lot of sense. So it's a lot easier to say, get the homeless people off the street than to say, let's go find better housing or better treatment that can lead them to treatment. It's a lot easier to lock people up who are involved in drug abuse activity than to say, well, maybe we can get them off drugs that perhaps will be able to do something about some of the problems in our community.
And a few more questions I wanted to ask is, do you think this is more of an inner city problem, or is this a national problem?
It is a national problem. I was raised in a rural community. I was told that the rural community didn't have these problems. Well, while I was in high school, I had classmates who had murdered their parents. I also saw suicide, which reportedly did not exist in the rural community. And I've been living in the suburban communities where we're seeing more of some of the issues that are involved in the inner city are moving to suburbs. But it was said that if where the bank robbers go to banks because that's where the money is, criminals are going to the suburbs because that's where the resources are. So this is a national problem. It is not just limited to just a physical location, and it's also not limited to a specific age group, and it's not limited to a gender. We recognize the problems that our young men are having, but also our young ladies are having difficulty. Some of our elderly people are having these problems as well. So it's cut across all demographic interstices.
In terms of the, I guess one last follow-up question. In terms of the current political apparatus, do you see a change in terms of the previous administration in terms of support of reducing the disparities of African Americans, or do you see a change in the support between the Biden administration versus the Trump administration?
I think there's a lot of change, some of it for better, some of it for the worse. The administration, first Trump administration, they acknowledged the existence of HBCUs, but did not keep their commitment in terms of what they would do in terms of improving HBCUs. I think that there was what I find is that some of the same Congress people who want to restrict funding for programs like Medicare, Medicaid, and others, when it involves their own family members, then their policies change and more consistent with support. So I've seen people across the spectrum recognize the kinds of concerns we're facing now in terms of disparities in care for health care and so forth, who may politically say things like diversity doesn't matter, or why don't these people pull themselves up by the bootstrap? But when it involves their family, their friends, their neighbors, they take a totally different stance.
Can you tell me just a little bit about the presentation you did just now, and what is the organization behind that? And can you
Sure.
talk
Sure. The organization is a regional organization of the National Medical Association. National Medical Association is a medical association that was formed primarily because African Americans could not become members of the American Medical Association. And membership was necessary to get hospital privileges and to develop a significant practice. So the National Medical Association developed a journal that I was editor of, but also became a real advocate for health care for the underserved. And it was the efforts of that organization that led to the development of programs such as Medicaid, which the American Medical Association did not initially support. So this is a regional group of I'm the treasurer of the local chapter, the Medical Charitable Society of the District of Columbia, and we're all part of a larger group, the National Medical Association, which is several months is going to have its annual meeting. Again, this is multidisciplinary, not one area of medicine, but cuts across all areas of medicine. It is also the largest African American medical society in the world.
African American. Thank you for your time.